All right, hi again, Kendall here. We're going to talk about how to tape an ankle. First of all, when should I tape an ankle? Well, if you go to the next video below, what you'll see is some functional testing of the ankle. But we would want to go through our history, observation, palpation, and spatial tests, and then go through those functional tests and see how they do. But one thing that I do when I tape an ankle is I want to indicate to you one thing, and that is that tape is a process where when you apply it, you're trying to restrict motion. And so with that being said, you can now tape any joints you want to because you're just trying to restrict a motion that causes pain or gives risk of injury. So with that being said, we know that inversion 85% of the time is our cause, and because of our good clinical exam, we have identified that this is a lateral ankle sprain because of our inversion mechanism. So we know that we're going to try to prevent this motion. So what are we going to do? Well, we're going to tape that joint into neutral right here and then eversion. Now, many times I see coaches as well as some athletic trainers ask the athlete to dorsiflex that foot all the way up like this right here before they begin to tape. That's wrong for a couple of reasons, but the biggest one is if I put tape on this ankle, I'm going to be laying into this anterior tibialis tendon, and that's going to start to wear on that foot pretty fast, and it's just going to be uncomfortable. One of the biggest things, if you want an athlete to get better, if you just want a patient to get better, they're going to have to be compliant towards your treatment protocol. And if you ask that patient to dorsiflex and then you put tape over that tendon, it's going to be painful, and they're just not going to wear the tape, and then they're not going to be compliant, and then they're not going to play because they're not going to be better. So you want this process to work and be effective. So here's our steps for taping an ankle. One is we're going to go into neutral. Notice this is a 90-degree angle right here. And number two, I'm only going to tape about 2 to 3 widths above this lateral malleolus or ankle bone right here. So I'm going to take my tape and go about 1, 2, 3 widths, and that's just about where I'm going to start my taping. Now, what I like to do personally is I like to take my tape and I like to go down just past this fifth head of the metatarsal and all the way into these metatarsal heads down here. The reason is I like the effect that the length of horseshoe that I get and the stability that I get out of that tape job. Now, there are other tape jobs out there. I'm not saying they're wrong. If you go on YouTube and you look up how to tape an ankle, you'll probably get as many variations as you can get videos. We all kind of tape a little different, but we have a few things that we do that are common and standard practice. But many of us have some variation to our taping procedure. Now, what I'm going to do is I'm going to replace my athlete, and this is something you'll have to do probably every time you tape. And it's not that the athlete's lazy. We just get a little tired and we forget. And plus my model's been sitting here now for 3.5 minutes, and so he will start to lose his ability to hold that foot up and stay connected. But he's going to do a good job. So the first thing I have is this pre-wrap right here. And notice I am rolling that pre-wrap off the bottom of the roll. That's a really important part, because if I take this and I roll it off the bottom of the roll, you can see I immediately get tension out of my pre-wrap, right? Well, if I take my pre-wrap off the top of the roll, you see how it's coming off the top, I have to go all the way around before I can start pulling tension. And if I don't pull tension on my pre-wrap, then I'll start getting wrinkles in my pre-wrap. And if I get wrinkles in my pre-wrap, well, that's how I'm going to get blisters. And one of the most common instances of non-compliance or a athlete saying, I don't want you to tape me, is they get blisters. And so you don't want to give blisters. Blisters causes a risk of infection, and let's face it, they're just terribly painful. So what we're going to do is we're going to roll it off the bottom of our roll of pre-wrap. Again, I'm starting just about 3 widths above that lateral malleolus, and I'm going to pull it pretty tight. Now, personally, I believe that pre-wrap has no place in the ankle taping process, but that has to do with the fact that most of the time we put pre-wrap on and we put it on incorrectly or too much of it. Now, notice I went one roll down, or one layer down and one layer back up, and I cut it off. And that's just about as much as you can get. I like to personally take the tape and go above the pre-wrap and onto the skin like this right here. That's an important step because I want to adhere the tape to the skin, not just adhere the tape to the pre-wrap. Otherwise, I just come out of this whole thing with a really tight sock. Notice I've kind of got a little bit of an angle there. And what I'm going to do is, after I put my first strip down, which by the way is called an anchor, I'm going to apply 2 more, but I'm going to go mid strip to put those on. Just like that right there. Then I'm going to come down here to the end, and I'm going to put a distal anchor on down at the end. Now, I don't want to pull tight, because imagine what would happen if I pulled too tight on this distal anchor. The foot naturally wants to spread out when it weight bears. And so by putting this strip on too tight, I restrict the body's own natural ability to spay out the foot. And that, again, is another comfort issue. Next thing I'm going to do is a stirrup. Now, on the stirrup strip, it's very important that you start that stirrup strip on the inside and pull out. Remember, we're trying to prevent a motion from occurring. We're trying to prevent inversion from occurring. So what I'm going to do is I'm going to take my tape, I'm going to give myself just a little bit of length here. I'm going to put it on, and smooth as I go, I'm going to catch underneath the heel, and I know my arm is going to cut that picture out, but if I pull here, I will start the whole process of eliminating inversion. Now, if 1 is good, 2 and 3 must be better, right? Almost everything we do on ankle taping comes in 3s. So I did 1, 2, and 3. Now again, this step must be applied from a medial to a lateral direction. If not, then you have really wasted your time on applying tape. Next, I'm going to apply another anchor. Now watch and notice how this anchor did not go up here, it went continued down here. And so now I'm at a point where I want to apply a horseshoe. Now a horseshoe obviously just doesn't connect at the back like a circle would. And I'm going to apply about 3 of these. And I say about 3 because sometimes you have just a little bit of extra space down here, and it would only be prudent for you to cover that up by adding strip number 4, or horseshoe number 4. All right, so here I am, got anchors, distal anchor, 3 stirrups applied from medial to lateral, and then I did 4 horseshoes only because I wanted to get to the bottom of the foot. Now I'm going to apply a strip known as a heel lock. And literally what I'm trying to do with my heel lock is take the tape and make a loop just like this right here. And I'm trying to get that loop applied around the heel and pull so that way I can stabilize the heel in a everted position. So this is what it would look like. And this is a continuous heel lock. The process that I do. I will go slow so you can see each step, but I start right up here at the top, and I like to come all the way around, and that puts me at a position where I'm coming behind the heel. Now remember, it's a loop. It's going to go behind the heel, right? So it's going behind the heel, making a loop, and then it comes back over the top. So it came under, around like this, and back over the top. Now here's where it becomes continuous. Is because as it comes over the top, what I do is I manage my tape to come back behind the heel from the other way and create a loop, pulling it back into inversion subtly. There go the name heel lock. So there was 1. There's 1.5. There's 2. And just as I said earlier, everything occurs in threes. I'm just backing that off, trying to smooth that one little roll down. I don't think that would cause a blister, but we're just going to try to make it look good anyways. And as I finish my third one, I come right back up and end right where I started, only in the other direction, securing that down. So, now we're going to close everything by applying an anchor, another anchor, another anchor. Then we're going to start another series of horseshoes. All the way down to the bottom, staying as parallel with the bottom as I can. And then I'm going to simply anchor the distal end to clean it up and secure all of my ends. And there you go. My nice, wonderful ankle taping procedure. Now, as I smooth that out, what I know is that this ankle taping is only as good as I am of a taper, but the biggest thing is knowing that this will loosen. So if that's the case, one of the things that I need to be able to do is give or apply or teach the value of an ankle brace. One thing that I do not just make as a practice, but I also would endorse is using ankle braces as a preventative measure, especially in sports such as basketball and football. I have seen personally the advantages of using ankle braces. I know that many people think that the ankle brace could make the ankle weaker. Well, listen, when the data comes out and says that that's true, then by all means I would like to look at that. But as for now, what we know is that there is not enough sound data coming from the research saying that an ankle brace makes the ankle weaker, especially if you use good conditioning skills or procedures like we talked about in the earlier chapter and module, where we talked about how to do aerobic conditioning, periodization, agilities, and things of such without wearing an ankle brace. So we can affect an ankle, and then also we can take care of an ankle just by putting the right amount of tape or brace on. So that being said, if you have any other questions, please shoot me an email. Go ahead and grab you some tape, try this out, and let me know how it works for you. Anything else you need, let me know.